Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. In the Going Deep segment brought to you by CO2 Lift in our Expert on the Microphone series, today we're joined by the incredible Dr. Mary Ojo-Carons. She's a cosmetic gynecological surgeon, sexual medicine physician, healthcare expert, researcher, and author. Yes, she's all of that. With almost 2 decades of experience, she's the founder of Climax Aesthetic Surgery and provides revolutionary care for her patients, educating both women and men about their bodies in a way that is easily retained and comprehended. She's going to join us right now to chat all about sexual health and wellness and how she's empowering her patients through transformative treatments. Welcome to the show, superstar.
Hey, thank you for having me. I appreciate it.
So excited to have you on. Let's dive right in. You are an expert and trusted consultant when it comes to sexual medicine and hormone therapy, and moving on even to now what's trending, menopausal medicine.
Mhm.
All areas that are often overlooked and under-discussed. I'd love to know what inspired you to focus on sexual medicine and cosmetic gynecological surgery. Why do you think there's such an important need for this right now, and why is this area so important?
Well, for me, it's actually a very simple answer why I decided to focus on it. I really just did not want to have bad sex ever. And I don't know a woman who wants to purposely have bad sex. Now, I think there are a lot of women that do have bad sex. There is not a man that you're going to find that purposely has bad sex, but I did not want that to be my story. And I don't think sex is just a fad. I think that there is a lot that goes into sex and sexual pleasure. And there are a lot of well-founded resources out there. There are a lot of well-founded options. And I wanted to be able to be a resource to patients. I think that it's really important to focus on sex because sex is not just about pleasure. It's actually about overall well-being. And so when you carve sex out and you make it only about pleasure, you actually diminish the significance of sex and what sex can mean for an individual and also a couple.
Ooh, it's getting hot in here. I love this conversation. And you're known for being an excellent communicator, so thank you for that. And you're highly rated by your patients for being able to educate both men and women about their bodies in a way that is easily retained and comprehended. I alluded to this in the introduction. Well, what's your philosophy on patient education? Why do you think it's so important to encourage these open discussions about sexual health?
Well, when you start to have open discussions, you actually start to demystify. There is a misconception that we all should know how to have sex. We all should know how to receive pleasure. We should all know how to give pleasure. And then when you actually get into the bedroom, many people find that's not the case. And so complexities start to arise in relationships because they're not actually walking through what they need to walk through in an open way, an honest way, honesty with self, and then honesty with one another. So when you encourage people and you're encouraged yourself to actually have an open, complete, honest conversation, you demystify something that actually can be very simple because it is natural. We have that natural urge, that natural desire to receive and give pleasure.
Now let's talk about the specific treatments you offer for both men and women at your practice. And I love that you offer treatments for both men and women, because usually we find doctors and they specialize only in treating one of the two sexes. But at Climax Aesthetic Surgery, I know you're dedicated to creating a friendly and a professional atmosphere that patients can actually feel confident to turn to for comprehensive sexual health care. And like you said, there's so many stigmas surrounding sexual wellness. And so with the latest cutting technologies and treatments, based on your experience, can you just walk us through a few of the most popular and transformative treatments you offer? What specific needs they address?
Yeah, so we do hormone therapy, like you said, for both men and women. We wanted to be able to offer something complete, right? And so hormone therapy, we do a lot of PRP therapy, platelet-rich plasma, basically growth factors that we get from you, the individual, as a source. You're sourcing yourself back with those growth factors. And we do acoustic sound wave, acoustic shockwave therapy with our soft wave device. These three therapies, what are they doing? They are improving libido. They are improving the tissue, making it feel better, making there be more sensitivity, and they're increasing blood flow to the area. There's so many options out there, you know. To your point, it's knowing what's available. And that's when you really have to had that conversation with someone who was walking down that path that, specializes in sexual medicine. So these three therapies, they work individually for individual purposes. Again, it's brain, it's body, but they also work very well together.
Now let's bring CO2 Lift into the picture. This is the perfect time to do it. It's a company which has harnessed the power of carbon dioxide to address both skin health and rejuvenation from your head to your toes, including the skin down there. And their product, CO2 Lift V, I can attest to this, addresses issues from vaginal dryness and laxity to urinary problems to sexual discomfort, and just the list goes on. And they're clinically verified, right? And their CO2 Lift Pro product, while often used for the face or body, has been used effectively on the penis for both enhancements and rejuvenation. So this is what you speak. I know you're familiar with all of this. How have you firsthand seen the CO2 Lift products effectively address sexual health issues for in the both male and female category, whether used as a standalone treatment or in combination with other procedures you offer?
So CO2 Lift, CO2 V Lift, it's a game changer because it's really all about blood flow. And so I use the product as a standalone, also in combination with all of the therapies I just named. And so, putting it on the penis, putting it on the vagina, putting it inside the vagina just makes that tissue much, much better. It gets that blood moving. If you're not going to use it, you're going to lose it. And that's an old adage, but something that we say in sexual medicine all the time. If you're somebody who is not moving around, you're not exercising, you're probably not having good sex. So if you don't get blood into the genitalia, into the vagina, into the penis, you're going to have challenges and you're going to have, you're not going to receive the outcome that you want. You're not going to have the orgasms that you want. It's not going to be as sensitive as you want it to be. So using the product with these procedures, but just as a standalone, I mean, it is a complete game changer. I've done surgeries where after the surgery, part of my post care is to put the product on the labia after I do a labiaplasty or inside the vagina after I do a vaginoplasty. Women that get this product, they're healing weeks faster. Like day one after, I usually see my patients on post-op day one just to make sure that they're doing well. Day one, you just see all of the healthy granulation tissue, the healthy healing tissue start to come in. You see that the area is still nice and pink and vascularized. That's what you want. That's what you want to see. That's how you know the product is working. So firsthand as a provider, firsthand as a patient, it changes the game completely.
That's a great endorsement, and you are saying things that I've heard over and over again from other experts, and I love that it's non-invasive and that it's clinically researched and, more importantly, clinically verified. That's so important in the scheme of things with so many products available and just not sure which one actually does the job it's supposed to do the way it says it's going to do it, right? Now, before we wrap up here, it's important to acknowledge that the hesitation many people feel around discussing sexual and intimate health has allowed many myths and stigmas to thrive. You alluded to this earlier. What are some of the most common misconceptions you encounter about both women and men's sexual health, and how do you go about dispelling them in your practice?
Do we have time for them all? Because there's a whole bunch. There's a whole bunch. I mean, I think one thing is that people don't realize that sex actually, the orgasm itself actually takes place in the brain. Like our genitalia, we need all that to work, right? But if our brain health and our overall well-being is not where it needs to be, we're not going to be able to receive pleasure to the climax that we could. I think there's also a misconception that everybody else is having great sex and, just maybe it's just me. Maybe this is just a problem isolated to me, which is totally not the case. As we get older, it is going to become more challenging. You watch these movies and people are screaming all over the place, hair is being thrown. That's not what real sex looks like. As we get older, I might not be able to be on that countertop anymore because it's just not comfortable. So I'm going to need something to help me help myself. I'm going to need some type of sex aid. Some people call it sex toys. Some people call it pleasure tools. You have like these nice angled pillows that just make it so that you can actually arch your back a little bit more. These aids should be added. They should be used. Products like CO2 V Lift, a nice lube, just like start at the basics, the basics. a nice vibrator. That's not just for women, something that you insert, but something you put on your clitoris. That's where your button is, right? These things should be part of the routine of sex. And so everyone out there is not having better sex, and everyone out there is not necessarily not using these tools. It should just be normalized. I think that's one of the other misconceptions.
I love how you just tied all of that together, and we could continue talking for another 30 minutes, but we are officially out of time. But I learned so much from you today, and it's your openness and and just your delivery that is very, very different than other practitioners. So I thank you so much for coming on. This was truly, truly inspirational because I love chatting with trailblazing women.
Oh, thank you, Zen. Thank you. I appreciate it. It's wonderful being here.
That was our Going Deep segment brought to you by CO2 Lift. That was the incredible Dr. Mary Ojo-Carons, Cosmetic Gynecological Surgeon, sexual medicine physician, healthcare expert, researcher, and author. Definitely check out her practice, Climax Aesthetic Surgery, at helloclimax.com, and follow her on the gram at helloclimax and at Dr. Mary Ojo-Carons. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxy therapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.